Good morning, students. Myself, Dr. Amruta Doijad, MPTH Neurosciences. I'm working as a professor at DY Patil College of Physiotherapy, Kolhapur. Today, we will learn about the kinetic. The contents of today's lecture are forces, various types of forces, force vector, force of gravity, and center of gravity of human body. At the end of lecture, first BPTA students should be able to define what is force. Also, they should be able to describe various types of forces, force vector, force of gravity, and center of gravity of human body. So what is kinetic? Kinetic is the area of biomechanics concerned with the forces producing motion and maintaining equilibrium. So in kinetic, we study about the forces. The kinetic gives us an understanding of why the motion is occurring. It is also referred as push, that is compression, or pull, that is tension. It is also called as push and pull mechanism and very well explained by tug of war. There are two types of forces, that is external and internal forces. External forces which are occurring on our body is the first force is gravity. Gravity is always extending a force on us. Secondly, wind, water, external resistance by therapists, various other objects like TheraBand, weight cuffs, etc. and the friction. These are the types of external forces, while the internal forces are muscles and ligaments. All the forces are vector quantities. Vector meaning which has got direction. All forces are the vector quantities and the force can be defined by point of application on the object, action line and the direction which indicates pull towards the source and push away from the source. And thirdly, it has got magnitude. The vector is represented by an arrow, so the force is also represented by an arrow. So it has got base, that is point of application. It has got shaft and arrowhead which indicates action line and direction. And thirdly, it has got length which depicts the magnitude. The force is expressed in pounds or Newton. So let us see the example of force. This is a vector HB, that is hand pushing on book. You can see a base, then shaft and the arrow. Example of human body. You can see a forearm hand segment, muscle on bone vector. So it has got base, then shaft and the arrow which is indicating the direction. Now coming to the concept of force of gravity. So first of all, see what is gravity. Gravity is the attraction of mass of earth for the mass of other object. On the earth, it has got magnitude of 32 feet per second square. The force of gravity gives weight to the object. The weight is the mass of object times acceleration of gravity. Weight is equal to mass into 32 feet per second square. The magnitude of weight is expressed in pound, Newton or kilogram. Now what is force of gravity? Gravity is again a vector quantity. It is again described by point of application. That is, point of application of force of gravity is called as center of gravity or center of mass. Secondly, action line and direction. The action line and direction of force of gravity of an object is vertically downwards towards the center of earth, and the gravity vector is called as line of gravity. Third is magnitude. So the gravity vector is described by point of application, that is center of gravity, action line and direction, that is line of gravity, and third is magnitude. The center of gravity. The point of application of gravity is called as center of gravity, or also called as center of mass of that object. The center of gravity is nothing but a hypothetical point at which the whole mass of an object is supposed to be concentrated. It is a point at which the force of gravity acts. Now coming to the location of center of gravity of an object. If you take any symmetrical object like a ball, the center of gravity is located at geometric center of the object. In case of asymmetrical object like a crutch, like a stick which is heavier at one side and lighter at another side, thus it is located towards the heavier end, while a object like crutch, the center of gravity is a hypothetical point which does not lie within the object. You can see here in the picture, in ball, it is located at center. In a stick, it is located towards the heavier side, and in crutch, it lies, center of gravity lies outside the object. Now coming to the concept of line of gravity. The line of gravity is an action line or direction of force of gravity on an object are always vertically towards the center of earth regardless of orientation in the space of the object. So, line of gravity is nothing but a plumb line, and a plumb line represents point of application, direction and action line of gravity. Now coming to a very important concept, that is center of gravity of human body. When all segments of the body are combined and body is taken as a single rigid object in an anatomical position, the center of gravity of the body lies at S2, that is second sacral vertebra. The center of gravity does not change its location in rigid body, but line of gravity keeps on changing. The line of gravity always remains vertically downward, but we are not a rigid segments as humans, but in reality the location of center of gravity keeps on changing because we are moving from one place to another. Now let us see about the segmental center of gravity of human body. If the each segment is considered differently, that is forearm, hand, it has got its own center of gravity. When two adjacent segments are combined, like forearm segment and hand segment, the new center of gravity lies towards the heavier side. So if it is a forearm and hand, it lies towards the forearm side. When all segments are combined, there is a single center of gravity. And when object is composed of two or more linked and movable segments, the center of gravity lies outside of all segment. You can see in the first picture, each segment has got different COG. In second, if the two segments are combined, that is forearm and hand is combined, there is a new center of gravity which lies towards the heavier side. In third segment, again the gravity, that is the forearm hand segment is combined and the center of gravity lies at the heavier side. And third is there is a realignment of the segments and where the person is doing elbow flexion. So here the center of gravity lies outside the object. Coming to center of gravity of human body, when all segments of the body are considered, then the location of center of gravity is anterior to second sacral vertebra. When the body is considered as a single rigid segment, single rigid upper body and rigid lower body, then center of gravity of each two segment will be rearranged, but the combined center of gravity will still lie at S2. When the trunk is inclined forward, like trunk flexion, the new center of gravity is created and it lies outside the body. And fourthly, when there is more disproportionate arrangement of body segment, like standing on one foot, that is single leg standing, the new center of gravity lies outside and between the body. You can see here the center of gravity is located at S2 when it is considered as a single rigid unit. Secondly, when the body is considered as into upper half and lower half, there are two different center of gravity. When the trunk is inclined forward, the center of gravity shifts outside the body and line of gravity falls beneath that. And when there is a more disproportionate rearrangement of body segment, here you can see a sportsman is standing on his toe, so the center of gravity is realigned again and it lies outside the body. So these are the this is the explanation for the center of gravity of human body. So what we have seen in today's lecture, that is about the definition of kinetic. What is kinetic? Kinetic is the study of motion with regard to forces producing motion or the maintaining equilibrium. So what is force? Force is nothing but push or pull mechanism, very well explained by tug of war. There are two types of forces, that is external force and internal force. Force vector, all forces are the vector quantities, that is it has got direction. Force of gravity is the whole force of the body is supposed to be concentrated. Location of force of gravity, that is COG, is located anterior to S2. There are different center of gravities for each segment of the body, and the center of gravity of human body, it in us in symmetrical, it is located at the center. In when the two segments are combined, it is located towards the heavier side, while in the if the trunk is flexed or body is inclined, it lies outside the body. So in this class, we have learned about the forces and center of gravity and line of gravity. Students, you can very well extend your knowledge by reading following books, that is Joint Structure and Function by Cynthia Norkin and Brunstrom's Clinical Kinesiology by Laura Smith. I hope you have understood the lecture, and with this we will conclude with the today's session. Thank you.